In this video, I would like to address the question, what is a cataract? It's useful to think of the eye as a camera with lenses at the front and a photographic film at the back. And there are two lenses in the eye camera. There's the cornea, which is the clear window at the front of the eye where people place contact lenses, which is the coarse focus for the eye. 2/3 of the focusing power is from the cornea. And then there's a lens inside the eye called the crystalline lens, which is the remaining 1/3 of the focusing power. And the reason we've developed this two-lens system is that the lens inside the eye can change its shape, and as a result it can change our focus from distance, looking at the horizon, to near visual tasks such as reading. Unfortunately, the crystalline lens inside the eye is the only organ in the body that continues enlarging throughout life, and this has a variety of consequences. First of all, for everyone, when you get to your mid-40s and onwards, the lens as it enlarges becomes less able to change its shape, and therefore its ability to focus you at near for reading reduces, and this is why people need reading glasses. And as it continues to enlarge, it can become cloudy, and a cloudy crystalline lens is a cataract. It can become cloudy in a variety of fashions, but for most patients it's a gradual blurring of vision, usually affecting both eyes but one more than the other. If you were to suddenly reduce vision in either eye, it's highly unlikely to be cataract and requires urgent medical attention. There are two main ways this lens goes cloudy. One is called a nuclear sclerotic cataract, where the central part of the cataract turns a brownish colour, and this has a variety of effects. Initially, it can actually strengthen the focus of the lens, so the situation arises where, in youth and to middle age, you're seeing well at all distances, then you require your reading glasses in late middle age, and then all of a sudden you find, as you're developing this form of cataract, that because it increases the focus in the eye, you can do away with your reading glasses and you can read without glasses, but it's getting more blurred in the distance. And then eventually, as it progresses, it's blurred at all distances. This type of cataract, because of its colour, because it's brown, also filters out a lot of colour from the environment, and everything becomes a bit sepia coloured. And people, after having cataract surgery for this form of nuclear sclerotic cataract, often mention things are much bluer as well as being brighter. The other form of cataract is what's called a cortical cataract, and a rarer type called a posterior subcapsular cataract, which is where, rather than a diffuse change in opacity of the lens, there are little patches of opacity within the lens, and these little patches of opacity results in light scattering, and light scattering inside the eye causes the symptoms of glare. So cataract causes either gradual blurring of vision or glare. And the treatment for cataract is surgical removal. The timing is when you feel the time is right, that is to say when you are sufficiently troubled, you want to have something done. And that goes for all operations. So that is a cataract, and in other videos on this website we will tell you in more detail how surgery is performed and what the options are for surgical intervention.